place it right here.
Great.
Easy to find. There's also actually good to see you.
Oh, good. Nice, thank you. Do you ever see the movie Signs? Oh yeah, they have as part of it. They set walking around different places, so it's pretty nice.
Great.
Hi, how are you? Sure. Okay. Yeah. Okay. Really, really tough one. It's really true. Yeah. Exactly.
Hello and welcome. And welcome to our partners who are on the North Campus with the North Campus Sustainability Institute who are watching from remote in Ann Arbor, Michigan. I'm so delighted that you're all here. I want to welcome you to the University of Michigan here in Ann Arbor. My name is Trish Koman, and I wanted to let you know that we will be recording this program and it will be webcast as well. We have many important things to celebrate today. The 50th anniversary of Earth Day is a really important event for the University of Michigan. I'm very proud to be part of the Environmental Health Sciences Department at the University of Michigan School of Public Health. 50 years ago, our department had students who were so committed to environmental protection that they helped to start a national and international movement that has really helped to protect public health. We know that there's a very strong connection between the environment and our health. And I am so delighted today to be organizing a panel and a keynote speaker to be able to describe one of our most important public health issues today, climate change. And I think it's very fitting that we have this opportunity and this moment to be able to reflect on our history and to be looking forward to the future. I want to take a few minutes to just thank our various sponsors. We have a wonderful program. I wanted to thank our Dean Dubois Bowman, and the Michigan Life Stage Environment and Exposure and Disease Center for sponsoring this. Our other partners include the University of Michigan School for the Environment and Sustainability, the Center for Global Health Equity, the University Medical School's Global Health and Disparities Path for Excellence, the University of Michigan School of Nursing, the LSA Residential College, and several student organizations, Climate Blue, Climate Reality Leaders, and of course, the Ecology Center here in town. It's my pleasure to introduce to you Dr. Marie O'Neill. Dr. O'Neill is a professor in environmental health sciences and at the Department of Epidemiology. She has long been an advocate on climate issues and studies the effect of air pollution and heat on our health and looks at differences in vulnerability among populations. So she's been a long time advocate for these topics. She's also participated in the National Climate Assessment and has been a strong voice for science and education. And Dr. O'Neill will come forward and introduce our speakers.
Thank you, Trish. It's my pleasure to introduce our speaker who will be providing us with opening remarks, and that's Dr. Joseph Kollars, who is a professor of health sciences education and the Senior Associate Dean for Education and Global Initiatives here at the Medical School at University of Michigan, Ann Arbor. He became the first Associate Dean for Education and Global Initiatives in 2009, and he serves as the medical school's lead for the oversight and expansion of the education mission and global initiatives. In this role, he leads efforts to adapt and enhance the full spectrum of medical training from undergraduate to continuing education to biomedical research education, and to bring it together with global impact. A major focus of his career is global health and strengthening education systems in low resource settings. He serves on the Fogarty International Center Advisory Council and is a co-principal investigator on one of 5 NIH Fogarty Center funded Global Health Fellows programs. He's also, since 2010, been the co-director for the Joint Institute of Translational and Clinical Research with Peking University of Health Sciences. Earlier in his career, Dr. Kollars and his family lived in Shanghai to help establish one of China's first Western-based healthcare systems. He is a practicing gastroenterologist who obtained his MD from University of Minnesota and completed his postgraduate training at the University of Michigan. So please welcome Dr. Kollars to give our opening remarks.
Thank you, Marie and Trish. And I think it's important for us to gather here on this 50th anniversary of Earth Day and to look back, but more importantly, look forward. As you heard from my introduction, I'm involved quite a bit in global work, and I spent a lot of time in Africa, and I'm reminded of a story that's attributed to Desmond Tutu. Maybe you've heard of it. Maybe apocryphal, but he talks about this situation in South Africa where they had a town that was at the bottom of this river, and there were constantly people falling in and drowning and having injuries. So they built a response team, then they built a clinic, then they built a hospital. And then somebody said, I wonder if we should spend more time figuring out why people are falling in the river upstream. And when I stand before you today with a white coat on, just coming from clinic, I feel that sometimes, especially those of us in the health professionals, we're spending a lot of time trying to fish people out of the water and less time really thinking about the social determinants of health and why are people becoming ill. And I think it's never been more important for those of us who are in the health professions to be able to be part of the conversation, part of the movement that is really linking the social determinants to better health. And of course, we're here today to think about that in terms of climate. This is relevant for our communities, relevant for our patients, those that we're called on to serve. But when we think about it from a generational standpoint, think about our children, think about our grandchildren. What's happening in the climate and the environment today is really a cause of concern. And I think all of us, from our perspectives, from the places we have in our community, with those that we work with, have to be much more active in the movement and bringing our voices forward to call for a different and better approach. So I'm extremely grateful that we do have a center here that works on this, anchored in our School of Public Health that Trish acknowledged. We have a whole school on sustainability and the environment that is dedicated to this, and I'm glad to see members of that faculty here represented in the audience for what are just crucial conversations. I'd like to now turn and introduce to you the keynote speaker that we're very fortunate to have with us, Dr. Renee Salas, who is an assistant professor of emergency medicine at the Harvard Medical School and an emergency physician at Massachusetts General Hospital. As you know, a lot of times people who are in emergency medicine are at the front door of our health system, who are seeing things firsthand and are often the first responders. Dr. Salas co-authored the U.S. portion of the Lancet Countdown on the climate crisis, healthcare and delivery in the New England Journal of Medicine, and is very much a recognized leader and prominent voice in the movement. She has roots in the Midwest and specifically in Michigan, where she grew up, and we're delighted that her parents could join us today for the conversation. Dr. Salas received her Doctor of Medicine from Cleveland Clinic. She's concurrently obtained her Master's of Science in Clinical Research from Case Western and subsequently received a Master of Public Health from the Harvard T.H. Chan School of Public Health at Harvard. She's had a concentration in environmental health that was also in part triggered by some fellowship training that she did in wilderness medicine while at Mass General. Her current focus in her academic professional life is on climate change and health, and we're really fortunate to have her as our visiting faculty as part of this conversation. Please join me in welcoming Dr. Salas.
Well, thank you so much, Dr. Kohlers. It's an honor to be introduced by you. And Trish, thank you for all of your work to get this set up. The fact that this is being held in a medical center is such an achievement, so thank you. So we're going to take a little break from coronavirus, right? This is a little bit of a pause. And I really am looking forward to setting the landscape across a national and domestic landscape. This is actually my last probably public speaking appearance for at least the near term. It turned out I was visiting my parents in Michigan, and so I was able to avoid the travel bans that are in place, and we'll be heading back after this. But what an honor to sort of end this speaking tour for now here in my home state. So what are we going to talk about today? So over the next 30 minutes or so that I have with you, I want to set the stage for how the climate crisis is impacting health and the healthcare systems, and then talk about two particular projects that I think sweep the gamut of how we can act on this collectively as a community, and then really try to focus on what we can do. And I know we're going to dive into that with a local focus on the wonderful panel that will follow. So I vividly remember being in medical school, not too far away, down in Ohio, and putting on my white coat, feeling a little bit like it's dressed up and a bit of like Halloween, and taking the Hippocratic Oath. And I can't remember exactly what I said, but I remember that at that moment, I committed to improving the health of my patients and preventing harm. Now, flash forward to 7 years ago, when I learned about the climate crisis and its impact on health, which was a fork in my road, and when I realized that that was my God-given passion and that that is where I was directing my career. Yet there was this tension between what I had committed to and what I was learning. And I was a little bit alarmed at the fact that I had never heard about it during medical school or residency, and that this was an attending physician. So you can imagine that as I'm spending all of my hours outside of the emergency department, focusing on this, I very quickly began to see it in the emergency department. And I think what Dr. Kohlers had outlined in regards to the river really resonates with me, and it's actually something I've used in other talks. So I want to tell you 3 stories. So the first is a 4-year-old girl who came in on one of my overnight shifts. It was her 3rd visit that week for an asthma attack. And as you can imagine, her mom was beyond hopeless about the fact that she couldn't protect her daughter and that they were sitting in the emergency department again. So as we were waiting for her daughter to be admitted upstairs, thankfully it was a quiet night, we were able to have a conversation about the fact that pollen levels had been enormously high in the greater Boston area that week, and that her daughter had had a lot of outdoor exposures. And this mother didn't know these facts, and she was very thankful to be educated about how she could help protect her daughter, and we talked about checking air pollen levels. Another story is a woman who came from Boston Logan Airport. So we're very close to the airport. We get a lot of people with luggage, not an uncommon sight. But this particular woman, as soon as I walked in the room, she had a Ziploc bag, I'll never forget it, with empty medication bottles. And there was still sort of a tree branch that was stuck within this bag. And she thrust it at me as soon as I walked in the room. And it turns out she had gotten on a plane from Puerto Rico following Hurricane Maria. And she came directly from the airport to my emergency department and had no plan about how she was going to continue to seek health care. So we filled her medications and we connected her with the social work team. But often we think about climate refugees as something happening somewhere else. And I would argue that given that the climate crisis intensified Hurricane Maria, that we are having internally displaced people here within the US as a result of the climate crisis. Now, the last story is one that just happened this past summer. So we were experiencing record-breaking heat, which unfortunately is a theme. I think we continue to break records. And there was an elderly patient who came to my emergency department with a chief complaint of fever. I've gotten to know the EMTs, having been there for 7 years now. And so as they were transferring the patient over to the stretcher, one of the EMTs I know well
told me the circumstances that they found him in. So they said they climbed up to the top floor of some lower income housing in Greater Boston. And they said that when they opened the door, a wave of heat hit them like they were in the Sahara Desert. There was no air conditioning, and they had only one window that was partially cracked. So as we got the internal rectal temperature of this patient, it registered at 106 degrees Fahrenheit, which, for any medical students in the room, this is board question, right? Answer C, that's altered mental status with an elevated internal temperature in the setting of extreme heat exposure is heat stroke. So we quickly re-triaged him to our high acuity area and cooled him. But I often think about his wife, who was left in the apartment. So I think this got me to thinking about how we need to add a climate lens to everything that we do, from our clinical practice to our research to our public health infrastructure. Because the reality is that we often like to try to predict the future by the past, right? How many of us, I do this, I look at prior urine cultures in order to try to decide what antibiotic to prescribe a patient. But the reality is the climate crisis has created an unprecedented future of unlike anything that we've seen. And we can't prepare for what we don't understand, and so we have to understand better what the future looks like. So what is this thing called climate change? It still gets me that these invisible gases, right, are wreaking such havoc. But I think we have a parallel now with the coronavirus. How can a virus, wreak such havoc? So human-caused greenhouse gases, with carbon being the one that we talk about most, is driving this cascade of changes. And the three big categories are rising temperatures, intensification of extreme weather. In fact, for the past 5 years, we have had more than $10 billion weather and climate disasters, which means that these events cause at least $1 billion worth of structural damage, and often immensely more. And rising sea levels. Not as big of an issue here, though. We do have the Great Lakes, and I know there's some work happening around that. But the rising sea levels is something that we definitely are thinking a lot about in Boston. So here we are, kind of in this thermometer, right? Let's figure out where we are. So currently we're at 1 degree Celsius above pre-industrial levels. Now the Paris Agreement, which I know hopefully everyone has heard about here, its goal is to keep us ideally below 1.5 degrees Celsius, if not below 2 degrees Celsius. 1.5 is only a half a degree away from where we are now. In order to achieve that, though, we have to cut our carbon emissions nearly in half by 2030. 2030 used to seem like a long ways away. It's only 10 years away. And we have to be net zero by 2050. So we're in this very critical window. However, if you look up to see kind of what our current policies and pledges get us to, it's estimating we could be at nearly 4 degrees Celsius by 2100, which frankly, from a health standpoint, we don't know what it looks like, but we believe it's catastrophic. But what does 1.5 to 2 degrees mean? So there was a great report that came out, and just to put it in terms of health, just that half a degree, it doubles the number of people who are exposed to extreme heat, and nearly 60 million more people globally are going to face severe water scarcity. But even 1.5, which is really what the next phase that we're looking at, looks drastically different across the world. And I think that's a theme of climate change, that it's not an equal opportunity impactor. And so the dark red means significantly higher temperatures, so up to 9 degrees Celsius. And you'll see that especially the poles are going to experience drastically severe temperatures, looking at a 25th and a 75th percentile. I don't know if people saw the headlines, but it was 65 degrees Fahrenheit in Antarctica last month. Same temperature as San Diego. Not exactly two things you want symmetry in. So what does this mean for health? So there's a broad range of exposure pathways, and I'll just highlight a few. But we know that extreme heat impacts a broad range of health impacts, from cardiovascular to cerebrovascular outcomes. It worsens mental health for those who already have it, increases violence and aggression, which I unfortunately see in my emergency department. It affects pregnant women, so preterm delivery, spontaneous abortion. Another one is air quality. So we've talked about the pollen levels with my patient's case. Those are especially rising in the Midwest. And in addition, though, think about wildfire smoke for anyone who's from the West Coast. We know that smoke has a broad range of impacts. And then the other piece to think about is fossil fuel combustion creates particulate matter, which we know has a broad range of negative health impacts, especially to cardiovascular and respiratory systems. And that is not only driving those health outcomes, but also driving the climate crisis. And so we're able to get a 2-for-1 if we're able to stop burning fossil fuels. The next one is thinking about food. So it actually makes crops less nutritious. So it not only decreases the protein content, but also the mineral content. And while for those of us who are blessed enough to sit here, it may not affect us as much, we think about our colleagues around the world who are already living at that nutritional fringe. Think about how we distribute food and what the risks are to our distribution. Thinking about water. So 8 pathogens cause nearly 97% of waterborne illness. All of them are climate sensitive. Think about algae blooms and Vibrio, which is a bacteria that loves warm oceans, and the suitability for that is increasing off of my coast. Next one is thinking about extreme weather. So not only do we think about injuries, right, in the immediate phase, that's what makes headlines, but there was a study that just came out in JAMA that actually showed that patients who are being treated by radiation therapy for lung cancer, that when their treatment is disrupted as a result of hurricanes, that they die sooner. As a close colleague of mine said, if we can connect climate change to cancer, then we know that it touches everything. The other piece to think about is vector-borne diseases. So Lyme disease, which is something that you face here and I see significantly in Boston. Every rash now has to be potentially Lyme disease. Vectors such as mosquitoes or ticks, they're living in new areas, living longer. And so we're seeing this widespread of Lyme disease across the Northeast and the Midwest. It also impacts dengue, which is something to think about from a global standpoint, and other infectious diseases. And lastly is the social cohesion piece. So displacement. I can't think of a population that has greater health risks than a displaced individual, as I think the patient's case that I talked about, that she had no way to connect to the healthcare system. So this is a broad sort of survey. We could literally spend an entire course going in depth on all of these. But I think that my personal view is that our current understanding of these health impacts is like an iceberg. I recognize the irony of this analogy. But we see what's above the surface of the water, but what keeps me up at night is that largest mass underneath. So recently, the rising temperatures was linked to bacterial resistance to antibiotics. I mean, as all the clinicians in the room think about, I mean, that's something that we already are concerned about as a healthcare community, but something that, again, if the climate crisis as the ultimate threat multiplier is making that worse, something we need to understand. Also linked to congenital heart disease. So some of these exposures differ by geographic region. But for the ones that are universal, even those vary by geographic region. So I want to walk you through this diagram. So you'll see that the climate region, Michigan is considered central for the purposes of this study. So you can see that the bulk red box is what the peak of heat-related hospitalizations are. So when people start to go to hospitals and get admitted for heat-related conditions. You'll see that it's about 86 degrees Fahrenheit here in the central region. There is that gray bar that you'll also see. That's when heat alerts go out. You'll see there's a stark discrepancy between when people are actually being harmed by heat and when heat alerts go out. And as a result of this study, people are making changes. And I think it shows the power of research and the need to make, as someone said last night, make the invisible visible to be able to prepare. But now compare that to the south. You'll see there's a nearly 20 degree Fahrenheit difference between when people are admitted for heat-related conditions in the South. Then compare that to the West, which they actually get hospitalized 5 degrees warmer or cooler. And I think this shows, right, the South is a historically warmer region. And so I think it also shows, right, that we as humans can adapt, not only physiologically, but also air conditioner penetrance and behavior. Obviously, people in those regions are used to dealing with hotter temperatures. So, and it also highlights an important theme that we need to work together and learn from our colleagues in other parts of the country. So I want to create this framework that we're going to spend the rest of the time kind of talking through in a few different pieces. So we have the rising greenhouse gases, and mitigation is the term for getting to the root cause or the ultimate prevention. Nothing's harder for me than having a patient in front of me where I don't have a treatment, but we have the ultimate treatment here. Renewables are often as cost-effective or sometimes even cheaper than other sources. And then we also think about the sustainability side, which is, I know, work that's ongoing here, because healthcare institutions produce 10% of the emissions. And that's actually more than some countries, just the US healthcare system. So we need to think through this. And then coming down, you'll see that its impacts on health, but then we think about adaptation. How can we adapt our public health infrastructure and add that climate lens? But then we also have to think about our clinical practice and the ability of our healthcare systems to continue to provide care when our communities need it most. So I'm going to dive into the public health side of things and talk about the Lancet Project. So the Lancet created a commission where they called climate change the greatest threat, and then on their subsequent commission, the greatest opportunity for public health. But they recognized that that wasn't enough, that they needed to track progress over a series of indicators until the year 2030. And so they created the Lancet Countdown. So you'll see that there's these 5 working groups, and in the center, we want to understand what the health impacts are, but we recognize that these exist within a framework that's economic and political, and the 2 blue circles down below show the solution. So how can we adapt and mitigate? And this is where all of the indicators are tracked through. Now, the global report is essential, and it creates a global picture, but it's hard for it to relate to us sitting here in Michigan. And so they create these policy briefs where we get deaggregated global data that we put and present in the brief, supplement it with peer-reviewed literature and federal resources to create a nationally relevant discussion. So we have created a working group around this. It includes over 50 organizations, and it's everything from academic institutions to federal science and technical advisors, to medical societies, to NGOs, because we really wanted to represent the breadth and depth of climate and health expertise here in the US. And I'm excited to see if we can get University of Michigan to join this after a discussion last year. So it also really resonated with the media. So we had the best media pickup that we've had, and we're covered in essentially all the major outlets, including New York Times and NPR. But you'll see the headlines here, that they all focused on a child. And the reason for that is that the key message of the report by Nick Watts, who's the executive director, was brilliant, because it really outlined that what happens to a child born today. And they describe it as having 2 paths. So not only, as it says here, is it going to define the life of a child born today, but we have a choice to make, and that child can walk a path where we're going to reach 4 degrees Celsius and certain sort of catastrophic health harms, or we can choose the other path to keep the world beneath 2 degrees Celsius. And that is what I'm excited about and gets me out of bed in the morning, because we're in this window. And we have that profound responsibility of being alive at a point in history where we can change the path. So we highlighted this in the US brief. We created this diagram, which was meant to show that we don't know what accumulated health impacts for a child born today really look like. But that as a child is exposed to all of those different exposure pathways I talked about, that they accumulate over the course of the life of a child who, again, up until 2037 when they breach through adulthood. But we also thought it was enormously important to show that there are other vulnerable populations other than just children. So we have a case study where we give the story of 4 different people's experience in an urban environment during a heat wave. And we talk about what some of these factors are that make people more at risk, like the patient I talked to you about, who was poor and elderly, and put him at increased risk for heat illness. I want to give you just a little preview. I hope you guys will dive into the reports more, because they're meant to be used in living documents. But here's just an example of the indicator. So this is a global indicator that shows that over 220 additional older individuals, so those over the age of 65, were exposed to heat waves globally. And the same is true that we've seen that same trend in the US. We also talk about what it does to labor capacity. And you'll see that the reddish, kind of bluish colors highlight more labor hours that are lost globally. And you can see kind of regions of the world that are most affected. And here's what it looks like for the US. So red being some of the highest potential labor hours lost, and really affects the South. But you'll see there's actually a signal here in Michigan, actually sort of in the very area that we're here sitting in today. Another working group talks about adaptation. So how can we make city-level risk assessments? And you'll see that about 70% of global cities and 2/3 of US cities have begun to look to see how the climate crisis puts their city at risk. And over half of global cities really acknowledge that it's going to compromise their public health infrastructure. Moving forward, the fact that a medical journal, The Lancet, that is for doctors, includes this graph, I think really shows the connection of how really the Paris Agreement is the world's greatest public health agreement. But we highlight that the carbon intensity has been decreasing. The latest data we had was for 2016. But unfortunately, we're ticking back up. So the 2018 shows that there was a nearly 3% rise in carbon emissions in the energy sector. So we're starting to, unfortunately, curve back. I'd mentioned before about the intimate connection with air pollution. And this shows that 64,000 people are estimated to have had premature deaths as a result of air pollution in the US. And this is in the study of nearly 3 million globally. And this, I think, is really important to show. I don't have US data included in the brief for this, but this is actually fossil fuel subsidies. And as a colleague of mine, Andrew Haynes from the UK, said, we are subsidizing our own destruction. So you'll see that now it's risen, subsidies have risen to nearly 430 billion and had been trending down, but have been trending back up over the past 2 years. So as we think about how to create a system where renewable energy is cost effective, this is driving us in the wrong direction. And the last working group I'll highlight is a 5th one, which actually looks to see, this is people who have clicked and searched for health-related articles versus climate-related articles in red. And you'll see that very few people look for both together. But if they look for connections, they go through the health lens, which really ties to the fact that we are the messengers that need to deliver this message about connections to health. So the last piece I'll focus on is the clinical practice in healthcare systems. So this really was born out of when we were developing the interactive graphic for the New England Journal, that I'd had discussions with close colleagues who said, okay, I get that it's a public health issue, but it doesn't really impact me in my day-to-day. Well, as I already shared, I mean, it is impacting us, sometimes indirectly, sometimes not in profound ways and more insidious, but it is impacting our day-to-day. So we created a Climate Crisis and Clinical Practice Symposium, which we launched on February 13th in Boston. And we brought together and I want to stress, every healthcare system together around this. They even gave us money to support this. So this includes Boston Children's, it includes Tufts, UMass, Harvard-affiliated hospitals. And they came together, which was a pretty, at least I'm told, historic thing to come together around this issue. Stressing again, if anything can bring us together, it's the climate crisis. And we had a discussion about how it's impacting clinical practice for different specialties. And we had healthcare leaders talk about how it's impacting healthcare systems. And this was published alongside it, which is a perspective in which I try to create a thought piece around how it's impacting my emergency department practice. But I sort of acknowledge in there that there's a lot of different ways to think about this. So not only do we think about how an exposure pathway is impacting our clinical practice, but we have to think about our geographic region, because again, we're all experiencing different exposures. And then we think about our specialty. And then we also think about our local healthcare infrastructure. So as you can imagine, this means that there are a lot of different perspectives, which means we need to bring people together collectively to think through it. So I want to just highlight, a couple things. So again, adding that climate lens to the pre-hospital environment, community paramedicine is something that's really emerging. And thinking about, as an emergency department provider, the EMS crews are really my extension out they're in the patient's homes. So how can we utilize them to help educate patients, such as the wife of the patient who was left behind? Thinking about our clinical practice. So triage. My patient was labeled as fever, and obviously was not fever. So we have alerts and pathways for sepsis, because we acknowledge the high mortality and the benefit of early intervention. Well, heat stroke, I would argue, is exactly the same. So we're talking through now about whether we have a clinical alert system where when the temperature is high enough to cause harm to our patients, that they're notified, and then that starts a pathway where at least the triage nurse gets an exposure history of whether the patient was exposed to extreme heat. I mean, my patient case, right, if he had come from an air-conditioned building, then maybe he had a urinary tract infection, but he didn't. And that very question obviously can change the course. I think about the only other thing I'll highlight on clinical practice for time is the idea of medications. So we think when we prescribe a medication to a patient that will improve their health. Well, unfortunately, certain medications make patients more at risk for heat-related illness. In fact, one study out of Australia showed that ACE inhibitors and a diuretic together caused a 3-fold increase in a patient's risk of heat-related illness. So should we be thinking about what we prescribe our patients for those that we know are going to be really at risk for heat illness? Another one is the fact that we expect the medications to work, right, when we give them. Well, there's evidence that albuterol inhalers and EpiPens, that when they're left to exposed extreme heat, such as a car during a heat wave, that they don't work as well. So I think about that, my 4-year-old patient who is an asthmatic, who not only is she getting hit with more exposures to cause asthma attacks, but her actual treatment may not work as well if it's been exposed to extreme heat. So this is just a preview to think about all of the things we need to understand better, because we don't understand all of these things now, and we desperately need research to better understand it. I'll kind of finish with this idea of the infrastructure and how it's impacting healthcare delivery. So anyone from Florida? So Hurricane Michael struck Florida in October of 2018. And the New York Times has a really profound article. It talks about healthcare providers and what was happening to them when they were in the hospital environments after their hospitals closed. So there's pictures of people who are literally bleeding, obviously needing care, but they can't actually access the hospital. But they highlight a tweet that a hospital actually sent a tweet to police to let a supply truck through so that way they could continue to treat patients. And I bring this up because our disaster preparedness colleagues, right, this is their bread and butter, but they are going to be facing unprecedented challenges. And we need to, again, work together to help support them to figure out how we can prevent tweets from being the solution. Power failures, I wanted to bring up a local example. So this is actually a hospital that's very close to where I live in Cambridge. And they had a power failure that happened on a 90-degree Fahrenheit day in Cambridge. So backup generators kicked in, but backup generators don't cool the entire hospital. So it got very warm on the top floors. And as you'll see kind of a quote here from this article, it says that firefighters had to actually move patients down from the top floor to lower floors. And then 7 hours later, when power was restored, some of the equipment was so hot that it wouldn't work. So they actually couldn't resume normal functions at this hospital until it cooled down. And this is, again, just a real-world example of what we need to think about, because this is from the National Climate Assessment, which says that, we often think about extreme events, weather events causing power outages, but extreme heat itself is going to be causing more frequent power outages. And they clearly say here in the report about that it's going to result in increased risks to public health and safety. I also think about our patients who require equipment that needs electricity. What are their backup plans? Lastly, I'll kind of highlight, do you guys suffer from the intravenous fluid shortage? So we had shortages as well. So this was following Hurricane Maria. There was a plant there in Puerto Rico that created or produced nearly half of intravenous fluids. And so after that factory was damaged, there was this widespread shortage, and we had it even in my emergency department. So people show up, right? They've been having gastroenteritis, which is vomiting and diarrhea, and they expect an IV, right? They're in Boston. So you can imagine their surprise when I would literally hand them a can of Gatorade and some dissolving Zofran under the tongue. And you can imagine some of the conversations I had. But it was an opportunity to educate about the vulnerabilities that we have in our supply chains. And again, we need to understand these so we can prepare for them. So all of this has led to an understanding that we are all experiencing the climate change differently. And so we launched an initiative following this symposium where we're going to foster these same conversations at 6 flagship sites in different regions around the US and Australia. But we want to continue to ramp this up, and would love if people are interested in considering having one here. Because again, the goal is that we need to get local healthcare institutions together to have these conversations. And one person in one place in one region doesn't have all the answers, but together we can do this. Which leads me to the last piece about what we can do. So I think this is a really important graph to sort of talk through, and I will kind of read some of the lower levels here. So blue means that an individual strongly or moderately trusts this population to talk about climate and health. Orange means that they distrust. So you can see that there is so really focus on the blue bars, but let me read off some of the categories. So over here we have television weather reporters, US military leaders, religious leaders, local public health departments, the EPA, WHO, climate scientists, CDC, and the second to left for you guys is family and friends. But the most trusted source is their primary care doctor. And this is true even for people who don't have mistrust or around the phenomenon of climate change. Even they will listen to their primary care doctor. So that leads to a really important and I think message that I hope you all take, which is that we have to talk about it. By not talking about it, we make it invisible. And so there are many ways to do that. I mean, one, I think, is how to improve your practice and just talking to your patients about how their health is being harmed by climate change. Similar to what I did around pollen. Because we can equip our patients with tools that empower them to protect the health of not only themselves, but also their children. And we also need to advocate for mitigation. Again, we can get to the root cause of this and prevent all of this downstream human suffering that we're already facing and will face in the future if we can get to the root cause. That's why I think it's important for clinicians to talk about the fact that climate action is health action. Thinking through kind of the other public health, clinical practice, and research, I would challenge all of you to add a climate lens to what you already do, not only in your practice, but in our public health discussions, and even in your research. Again, that whole mass of the iceberg underneath where we need answers, we can add specific aims to existing research infrastructure to start getting answers to these questions. So how does temperature affect whatever it is that you already study? We also, of course, need to increase funding for people to study this directly. Looking about healthcare sustainability. So again, if we want to model a path forward for a sustainable future, we have to do it at our hospital first. Because what we're doing at our hospital is actually harming people who are then coming back in through our doors. Personal lifestyle changes, again, none of this is going to move the needle overall, but all of us, we need broad systemic changes. But it's really important to think about what we do as individuals. And in reality, us as healthcare providers, what we do and how we act and the decisions we make can resonate with others in the community more than others. And so we have to acknowledge we have this respected position. The last two I bring up, some people, they're a little bit more on, I think, the fringes still. We're talking about divestment, so divesting from fossil fuel. People make an argument that we divest from tobacco because we know that it harms health. What's the difference? And the last one I want to highlight in honor of Richard Horton, who's the editor-in-chief for the Lancet. And he made a call recently saying that physicians should engage in nonviolent civil disobedience. And some of the parallels, too, are around the IPPNW and the way that physicians took a stand on nuclear war and the harms that that was going to have to their patients. And they ended up winning a Nobel Peace Prize for it. But in the end, I always go back to being in the emergency department because I think there are so many lessons there that resonate. So when we save a patient that's in front of us and critically crashing, right? There's this window where if I give a patient a treatment in a certain window, it will work. If I give it outside of that window, it won't nearly have the benefit to that patient's health that it would if I'd given it in that critical window. Well, the reality is we're in that critical window right now. And so what we do now matters a lot more than what we do a decade from now. But I also think about that what saves that patient? It's not me. It's a team of people, right? Everybody from environmental services that cleaned that room so that way that patient could come in, to the pharmacist who got the meds, to the nurse, to the tech, to the med student, to the team upstairs. And that's why I get the most hope in working in this, is bringing people together. Like the dinner we had last night with a multidisciplinary team having conversations with different perspectives and ways to tackle this, because we need novel, out-of-the-box thinking. And I heard ideas that were fantastic last night. And I'm really excited to see what you guys can do here that we can all learn from. So in conclusion, I go back to that child. We all have children in our lives. So think about that child. And if that doesn't motivate you to act, then think about your aging parents, because they're also vulnerable. And if that doesn't move you to act, then look in the mirror and think about yourself. Because reality is that we have a profound responsibility, and we are the trusted messenger that can make climate change personal through health. And I'm really excited to hear on the subsequent panel about how you guys are going to planning to do that here. Thank you so much for your time.
All right, so I think I'm going to hold questions and invite our panel to come forward, please. Please have a seat. I think you've got a microphone there. Great. You can turn the microphone on, just the switch. Yep. Great. Thank you so much. All right. So we've heard a bit about the importance of reducing greenhouse gases to public health. And we've also learned about the important role that public health professionals have with regard to being a trusted voice for science, as well as advocates for vulnerable populations, and also running a facility. So I think that we have a lot of very important work ahead. There's also a lot of exciting opportunities to create more healthful communities and systems as well. So we're fortunate to have climate leaders with us here today with a lot of experience in fostering healthier places. So I'm going to go ahead and introduce our speakers, and then we'll ask some questions of them. So first we have Mike Garfield. Mike Garfield has worked for Health, Environment, and Justice in Michigan for over 30 years. He has served as the executive director for the Ecology Center since 1993. Mike has been one of Michigan's leading voices on environmental issues. He's been the architect of some of the state's most ambitious initiatives in land use, transit, and solid waste. Under his leadership, the Ecology Center has grown from a primarily local organization focused in Washtenaw County into a regional and national leader on environmental topics. Mike is a tireless advocate for health and leads an organization with deep connections to Earth Day in Michigan as well. So welcome, Mike. Seated next to him is Guy Williams. Guy is president and CEO of Detroiters Working for Environmental Justice. He is the recipient of the Bucknell University Alumni Association for Service to Humanity Award. He was also named the Michigan Green Leader by the Detroit Free Press. He has many other honors to his name. Guy has also served on the Stakeholder Advisory Board for the center, the M-LEAD Center that is helping organize today's program. And he's a co-author of papers with me on heat stress, vulnerability, and justice in Michigan. So welcome, Guy.
Thank you, Trish.
And finally, Steve Dolan is here at the University of Michigan. He began his career in 2010 as the Executive Director of Logistics, Transportation, and Parking, and is responsible for planning and operating a transportation system here at the university that serves approximately 6 million riders a year. Prior to coming to the university for nearly 20 years, Steve held positions of responsibility in the transportation, supply chain, and 3PL third-party logistics field. And as part of the University of Michigan leadership, Steve is continually improving an efficient transportation system to support university faculty, staff, students, and visitors to get where they need to be on campus. He graduated from Oakland University and has lived in Ann Arbor since 1997. So welcome, Steve. So I think we're going to start our discussion with Mike. So the Ecology Center has some significant history with Earth Day and related to the anniversary. Can you tell us a little bit about the history with the Ecology Center and how it's involved in climate action?
Sure. Thanks, Trish. How's the sound? Good. It's terrific to be here this afternoon, and it's an honor to be on this panel after hearing from Dr. Salas. 50 years ago, as Trish mentioned, a small group of students, faculty, and community activists organized the teach-in on the environment right here on the University of Michigan campus and in the Ann Arbor community. Was the first of all of the Earth Day events that took place around the country, and maybe because it was the first, it became the largest. It drew 50,000 people over 4 days, and it was, as I said, the first of all the Earth Day events, which themselves at the time, mostly held in April later that year, were the largest social protest ever held in the United States at that point in time. After the events in Ann Arbor were over, the organizers created an organization, the organization that's today known as the Ecology Center. And for 50 years, we've been fighting for healthy people and a healthy planet. The movement that started with that first Earth Day was the movement that led to the passage of all of our country's most important environmental laws. And it was a movement the likes of which we haven't seen on these issues since, but I'm going to suggest we need to see again. The Ecology Center, the Ecology Center today works in all of the projects and campaigns that we're involved in. We work at the intersection of environmental issues and human health. So for us, environmental issues are health issues. And if we're working on solid waste and consumption issues, if we're working on toxic chemicals policy around issues like lead poisoning or the PFAS chemicals or other toxics, or on climate change, we're looking at them all through a frame of health and public health. In the area of climate right now, the work that we do is focused on state and local policy. We're one of the leaders at promoting renewable energy and energy efficiency at the state level on the electrification of transportation in Michigan. We're a leader in campaigns to bring regional transit to Southeast Michigan. And we're one of the leaders of local efforts here to take strong, ambitious climate action in Ann Arbor, Washtenaw County, and in all the institutions and local governments in the local area, including the University of Michigan.
Great.
Oh, one more thing, if I may.
Yeah.
I'll talk a little bit more about this later, but one of our key projects in the climate area is what we call our Health Leaders Fellowship Program, which brings in health professionals and public health professionals to be trained in environmental advocacy and education and ways to get involved in public policy and civic engagement. I'll talk more about that later.
Yeah, that's a great program. I really admire it. So, Guy Williams, to you, Detroiters Working for Environmental Justice has long advocated on environmental justice issues for Michigan and nationally, and has been a leader in terms of bringing Metro Detroit to consider climate action in its planning. So can you talk a little bit about how you would define environmental justice and climate action?
Sure, thanks, Trish, and I want to say thanks for inviting me to be here. I'm very excited. And actually, part of my personal story ties back to Mike and some of his colleagues in that in the mid-90s, I moved here from my home area of Washington, D.C., and the only people in Michigan I knew were people who worked at the Ecology Center. Mike and his colleagues, Tracy Easthope and Charles Griffith. And that, I mention that both because I have a long history of teaming up with them in their projects, but also the impact of the work that Mike described was already nationally felt by a novice in the movement as myself. So their work inspired me. And to your point, Trish, I mean, how I would define environmental justice is one thing, but I handed out some props. I didn't quite have enough for everyone. A sheet of paper that looks like this, which are principles of environmental justice. And it's how an international congregation of folks defined environmental justice back in 1990. And this platform has served as a guiding set of principles for all of us in the movement since that time. Simply put, environmental justice would look like no people being harmed from environmental exposures that are preventable. I mean, which is a wide range. I mean, there's so many exposures that we know we can do without today, given the current state of science, given the current state of potential change in policy. There's no excuse for the types of impacts, such as the mortality levels due to air pollution that was mentioned earlier. We have a recent study that a team of collaborators from Michigan School of Public Health and my organization published just a couple years ago with local air pollution data that showed that more than 18,000 hours of time, production time in work and school is lost, that close to 700 people a year are dying from air pollution related illness, and that this aggregate is putting close to a $7 billion drain on our local economy. So, I mean, one way of looking at what environmental justice would look like is that people are breathing and drinking healthily, and their bodies are vibrant and able to manifest their natural immune system. And that's really not the case. Everything's getting suppressed by the breath of chemicals that we're exposed to, and that has to stop.
Great. So important. Steve Dolan, the University of Michigan has had greenhouse gas goals in the past, and with the university president's Commission on Carbon Neutrality is going to be setting some future goals as well. So U of M has been involved in adopting various advanced technologies in the past and strategies to reduce some emissions. What are some of the key things that have been done and some challenges ahead?
Well, thank you for the question. And before I get to the transportation, I think we have to set the stage a little bit. And one of the pieces is we talk a lot about transportation. The other area that I oversee is parking for the university. And it's really nice to be here at the health system and talking to people about parking who are really interested in alternatives. Because most of my time when I'm here talking to the audience at the health system, it's really about how can I have more parking right next to my office building or clinic or research facility. So it's a big challenge, and I bring that up because a lot of the effort and a lot of the challenge we have is cultural. We've talked a little bit about the changes that we all need to make, and our culture still is driving our single occupancy vehicle as close as we possibly can to our work site. So that's one of the big challenges. So how do we solve it? And this gets to some of the questions about what we're trying to do. And I think some of the ways we solve it is offering more frequent, reliable, convenient mass transportation opportunities. And so that's really what we are focused on at the university. We do have some goals to reduce our emissions per passenger trip. So there's a couple ways we can do that. We currently operate a big fleet of diesel and hybrid electric buses. We are focused on looking at technologies that reduce the emissions, right? So right now that technology is electric buses. To be able to bring those kind of things to our campus, we needed the facilities to operate and maintain them. So I'm very pleased to say we just recently had a building approved for us to build a new facility where we can operate and maintain electric buses. That's going to be a big help for us. And so that's kind of the near term. So we'll continue to focus on that in the near term. The other things we really try to promote are alternative transportation strategies. Besides, once you get to campus, it's bringing people in from outside. So we promote other alternatives like van pools, car pools, express bus services from near-in communities to Ann Arbor. And so we really try to focus on convenient alternatives other than driving your vehicle to campus. Intraday transportation is a big deal too. We have a lot of movement across our campus. We basically have 5 campuses starting down at the south with the athletic campus, moving north to the central campus, then the medical campus, which is here on top of a hill in a river valley in a very congested area. So we have lots of challenges with congestion and getting people in and out. All the way up to the north campus where we do tons of research. And oh, by the way, it's where we have all the area available for growth for new facilities, and out to East Ann Arbor where more medical campus. And so our challenge is connecting those. And how do we get people to move back and forth for academic research mission type purposes? Right now, Trish mentioned our bus system. It's actually, we operate nearly 8 million trips a year now on our bus system. So it's very, very, very busy. Sometimes it looks like a bus system in Mumbai, India, with people cheek to jowl packed in the buses. So we have very good usage. But it's not always convenient for everybody. So we continue to look at new technologies and systems for high capacity transit to connect the campuses. And those are really where we're focused right now on kind of more the medium to long-term future, is connecting the campuses with some sort of high capacity system.
Great. Well, I think connection is an important theme. So for the panel generally, we know that we need to reduce greenhouse gas emissions, and we'll have to define and redefine some of our systems, transportation, food services, the way that we do land use patterns, how we dispose of waste, many of our systems. And these systems and the options to improve them are very interconnected at the university, at the local level, at state, regional level, et cetera, and beyond. And so what are some of the strategies for successfully dealing with the broad issues that cut across these many layers that we have to encounter? Some ideas?
Well, at one issue, at one level, this is a very simple issue to address. Dr. Salas mentioned it. We simply need to stop using fossil fuels. It's not at that level. It's not brain surgery, you know. Maybe there are some brain surgeons in the audience here today. You know, for when you look at this. When you look at this at a practical level of implementation, however, it's really complex. And it's like Steve said, it's about our culture and the way our culture leads to certain behavioral changes, but it's also about the way our economy is structured and the way our public policy is written. And each of these things interconnect with each other and influence them. And so without getting into the particulars of energy policy or transportation policy, I want to suggest one overarching notion here, and that is that we badly need to look at these issues beyond their ordinary framework. And what I mean by that is that these issues are so closely interconnected. The issues that lead us to use too many fossil fuels, and I'll just mention one of them right now, and I would suggest to you that housing affordability is a climate change issue, and it's a big climate change issue here in Ann Arbor and Washtenaw County. It's a climate change issue in many parts of the United States and many parts of the world, but for those of you who live and work in the Ann Arbor area, I think you're well aware of it. And it hasn't been this way forever. But over the last 20 years, Ann Arbor's become an increasingly unaffordable community to live in. Many people who work in Ann Arbor are forced to commute greater and greater distances to get to their jobs. And many people work in Ann Arbor now, and that didn't used to be the case, but over 80,000 people commute into Ann Arbor every single day to work here at the university or to private sector jobs or other public sector jobs in the community. We need to start thinking about that issue, among others, as an environmental issue and as a health issue, because they're intertwined. And we can address some of it through transit, sure, and it's important that we do, but it's also important that we look at the root causes. And the root cause of that issue might be affordability of houses and our land use and development patterns. And to solve it, we're going to need to get to those root causes. And if anyone here would like to explore that a little bit further, I'm plugging an event, another workshop that we're holding this Saturday at the Ecology Center's office downtown on just this very connection with some experts working on the whole issue of housing affordability in Ann Arbor. It's at 10 o'clock at the Ecology Center office.
Great. Guy, did you want to comment on the connection between these different layers?
Yeah, I'm a little hesitant to start. I might never stop about the connectivity. But I want to do my best to keep framing some of these in terms of the principles of environmental justice because of a few things. One, there are long-standing principles that have served our movement very well for going on 30 years now. And they're so applicable to the setting right this moment. I mean, for example, number 16, environmental justice calls for the education of present and future generations, which emphasizes social environmental issues based on our experience and an appreciation for our diverse cultural perspectives. So we just heard laid out there the impact of culture was already recognized and described as part of the remedy in our platform of principles here in the EJ movement. And so I wanted to comment about voting and understanding civics and the power of government, or the lack thereof, as related. Because part of my journey is, once upon a time, I was just one of those people in the public who didn't know anything about this. And then I started working at an environmental group, and I soon learned that there was this whole huge pile of what I call the rule book of policies that govern the main activities, not talking about violators, but businesses and people going by the rules. And recognizing that the impact of as business as usual was creating a disproportionate burden of poisons and illness on people of color everywhere in our country and around the world. And I was given a God-driven passion to be part of that solution. So I have something in common with our guest speaker here in that regard. And so my thought today is to try to expand your recognition that there's a lot more that you don't know that you don't know. We're not going to finish it in 15 minutes. But I want you to appreciate that education and curiosity are at the foundation of finding a way out. We have to remain curious. We have to ask questions. And that goes to a time of right now where we have candidates running for office. Question them about their understanding of these issues. What do they have in mind to put in place, and vote accordingly? Like that's really important. And it also ties back to, let's just pick another principle, number 5. Environmental justice affirms the fundamental right to political, economic, cultural, there's that culture again, and environmental self-determination of all people. So where we have issues of voter suppression and those kind of dynamics, where we have experience like we had in Michigan of democracy totally getting thrown out the door with emergency managers taking over the voice of the people, this is interconnected. Those of you, there's no one in here who hasn't heard about the Flint crisis of water, I'm sure. But I bet you there's a lot smaller group of you who realize the direct connection between that crisis and the role of emergency managers in government in Michigan. And probably a smaller group there that understands the tens of thousands of people who were cut off from running water until yesterday, I believe, was a decision made to start bringing relief, because all of a sudden the coronavirus is out there and it's like, wait, the best protection is washing your hands. Well, wait, we've got thousands of people in our city who can't wash their hands. Duh, like there's an interconnection. But my point here is that if it hadn't been, what my opinion, stupid and overreaching governmental decisions about a decade ago, none of these other pieces and threats to our health of the city would be in place. So I would just urge you in this day of elections and season of elections, if nothing else, arm yourself with more understanding of what's being considered impossible, and hold those people running for office accountable to discuss it and think about it. And lastly, this morning I'm getting besieged by requests to sign on to comments because our federal government wants to wipe out a lot of the protections of our National Environmental Protection Act, also known as NEPA. That's just ridiculous. Like, we don't have enough protection to begin with, so we want to have less. So for me, the theme of interconnectedness is like personal responsibility to creating a framework of society that works better for all of us.
Great. That's a really important thing to think about, creativity and connectiveness. I think that one of the things that we have to challenge ourselves for, and this will be the last question to the panel, and then we'll open it up to the audience for questions. If you didn't have some of the regular constraints, so if we could relax some of our usual barriers to have that creativity of thought, and especially thinking about things that prevent action on climate, What's the most important next step on climate action from your perspective? So Steve, let's start with you.
So in my role here, the constraints are space, right? I think we have to learn to operate within the framework that we have. And I think one of our constraints is really having the ability to limit some of our conveniences. So if we could get across, just be a little bit more militant about the way we operate some of our systems and make it more difficult to do things that are impactful to our environment, like the way we commute, that would be helpful. It's a very challenging thing to do, and I see all sides of this in my role. So, for instance, sometimes it's a challenge for the leaders here at the health system to attract the best and most qualified candidates to work here because it is a very difficult place to commute to and from. But if we could just make it so that it's just expected that you do something different than what you do today, I think that would go a long way in helping the culture.
Great. Guy, do you want to add to that? If you could relax a constraint, what would that be?
Which constraint?
Yeah, which one?
I would relax a constraint that carbon-based fuels are the dominant way of generating movement, power, and that the related impact on agriculture would be removed.
Great. And Mike, how about you? Relax a constraint or the most important climate action?
Well, if I could relax one constraint, it would be to relax or remove those subsidies that Dr. Salas mentioned that support the fossil fuel industry. And instead of subsidizing the problem, I'd subsidize the solution. But I'll suggest that the political barriers to making that happen are so large that the only way imaginable for them to for that constraint to be relaxed would be by everyone in our society or all major sectors of our society rising up to demand that change, starting with health professionals, the most trusted voice on health and environmental issues, on climate issues, but to our entire culture at the level that we might have had back in 1970 and maybe more so.
Great, thank you. So at this point, I'd like to open up the discussion to those in the room who may have questions. I want to invite Dr. Salas to come up also. What are your questions?
I'm Jonathan Levine from Urban and Regional Planning. I think one of the most important roles that each of us can fill is the role of constituents of local institutions. So constituents of our city of Detroit, city of Ann Arbor, constituents of the University of Michigan. These have, with the withdrawal of the United States from the Paris Accord, these local institutions have taken on the burden of seeing themselves still adhering to Paris climate change goals. What specific policies should we be advocating for with our local institutions, our municipalities, and the University of Michigan?
So I'm going to just repeat the question for those on the webcast. So the question was, with the U.S. withdrawing potentially from Paris and our responsibility as local constituents, what are some of the most important actions to take?
I'd like to start on that one. For those of you who live and work in Washtenaw County, let me make you aware of a few initiatives that are underway right now that may support what Dr. Levine's trying to get at here. And you're probably aware in the university community that the university is developing a carbon neutrality plan. I hope that moves quickly and is as ambitious and impactful as possible. At the same time, the city of Ann Arbor has already drafted its own carbon neutrality plan, which addresses a whole range of systems from transportation to land use to waste and food and consumption to energy usage. That plan is up for presentation and adoption in the next month. The Ann Arbor City Council will be reviewing that later this month, and we'll be voting on it in April, and then they will hopefully be providing sufficient resources for it in May, right after that. I'd urge everybody here to, if you live in Ann Arbor or work in Ann Arbor, to urge the mayor and city council to support this effort. And it's not just Ann Arbor. Washtenaw County has also declared a carbon neutrality commitment, and they need to take their first steps on it at it too. And the public school systems in Ann Arbor has created a very ambitious plan to bring clean energy to its buildings. And all of these institutions and all the other major governments and institutions in Washtenaw County need to be doing likewise. We're at a moment in time when a lot can change locally, and it's going to need everybody's support to make it happen.
I'll just add something as well. And I mean, I think the theme in hearing the panel, and thank you so much for your remarks, I really appreciate that, is we need political will. We have the solutions. And, you know, for everyone in the audience, your voice matters, but I kind of want to speak directly to health professionals. I mean, if you show up in a white coat to talk to your local legislator, they listen to you because, right, there's not many people in white coats that come and see them. And so just recognizing the power of your voice. And I think, you know, to that carbon neutral piece, I mean, the two biggest emitters from a carbon standpoint are transportation and energy, which I think, you know, is sort of just to reiterate the theme. And so those are really the two big targets. If we want to have quick, drastic action, those are the two sectors with which to target. And just making that connection through a health lens. And speaking about it, the fact that switching to renewable energies will improve health, especially, and promote health equity. And the same for transportation. And I think framing it in that way that makes it personal is more powerful than I think anything else. Because it's not about polar bears or icebergs, it's about us.
Other questions? Dr. John.
My question is, what can be done to help the University of Michigan in general and this medical center in particular to take climate change more seriously? As a little background of that, as many of you know, President Schlissel announced in October of 2018 that he would be appointing a commission to explore carbon neutrality. However, their report is not due out until this fall, about 2 years after it was announced. And the university has largely declined to undertake new initiatives towards carbon neutrality, declining even to go for what I would consider to be low-hanging fruit. Also, this medical center is embarking on a $920 million hospital construction project. You can see the construction undergoing just a block away from here. And you know, on the good side, it's a LEED's Gold project, but on the bad side, it's a long way from carbon neutrality. And many of us are concerned that it will be a carbon drain on our local environment for decades to come, the way it's being built. Many of us are working on the university, and I'd say there's tension in the air whether the university is about to come forward with big actions or whether they are being laggards. Dr. Salas, perhaps you have experience moving your medical center with political will in Boston.
So I'm going to just repeat the question. So what are some ways that we might move forward on carbon neutrality here at the University of Michigan?
I really appreciate your question, and thank you for all the work that you and your colleagues are doing. I think the most important thing about talking about climate change is finding what makes it personal for whoever it is you're talking to. So whether that be the person in front of you or that sector. And so, for example, institutions care about their bottom line. And I think an interesting piece actually that I want to share from the discussion we had in Boston at the recent symposium was that the CEO of Boston Medical Center, when asked why she moved her institution towards net zero emissions, and she said money. It was more cost effective, and so it saved her bottom line. And I think just recognizing, right, that whatever it is that will move the individual towards what the right action is, I mean, whether that's framing it from financial, and again, oftentimes it is a financially sound decision to move towards carbon neutrality. It's, different financial advisors are advising towards divestment from fossil fuels. It's a sound financial decision. But I think the other piece, right, is also framing it from the health lens of talking about, like, we can prevent X number of asthma visits by doing this, and recognizing that we already are going to have an increased strain on our healthcare system. And so we do not want to be contributing to our own, overrun healthcare system. And so we need to do that and framing it through that health lens, because that's powerful. And I have to truly believe that if anything makes this issue non-political, it's health.
Keep talking and organize is what comes to mind for me. I mean, I appreciate you raising the question, and I've been at this long enough to be very excited when someone basically says LEED gold is not good enough. Like, that's awesome. And I believe it's true, especially given the time frame we now know we're working with. However, I've also been around long enough that I was part of the formation of Healthcare Without Harm, which is still happening. And I remember our very first significant campaign of transformation of normal practices was about mercury, and how to get mercury from common use in the healthcare sector, and creating a contest and awards and things of this nature. And I raise that up as hope, right? Like, it sometimes seems so big that it's not possible. But right today, you cannot find a mercury thermometer. I'm really glad about that. I'm happy to be responsible. I would say call on groups like Healthcare Without Harm, Physicians for Social Responsibility, and others who've been in the game. And I'm pretty sure there's a local chapter of PSR somewhere around here, right? Like, that's where I would start. There's not. There's one at Wayne State, I know that. But I would say start with a core of active people who have been thinking, and organize relentlessly. And that will make a difference.
Great. I think we have time for one more question.
Thank you all for your comments today and for your presentation. I really appreciate this conversation. My question, I think, is about equity, and it's about equity within medical care institutions. So we've had a lot of conversation today about the leadership role of physicians and the role that they can play in creating change within our institutions, and yet an undertone and in some cases more explicit in the conversation today have been conversations about equity, about transportation equity, who commutes the farthest. Generally, people with the lowest incomes commute the farthest to come to Ann Arbor and to work in our institutions. They have more time on the road if they're asked to be commuting by bus or whatever. It's more of their day. Our physicians can have the income that allows them to purchase a permit that allows them to park right here. And so there's an inequitable burden in terms of the costs around transportation. Those are linked to housing, which has already been part of the conversation. And yet we've heard very little about the role of staff at institutions like this other than physicians and the role that they can play in promoting change, institutional change. So I just wanted to invite whether anybody wanted to make any comments around that.
So the question was regarding health equity and thinking through all levels, staff and others of the health system. What are the equity considerations?
If I can kick us off and say that, I agree. So, the climate conversation is intimately connected with health equity. And I think framing, it's very powerful and I think important, and I appreciate your point, in framing it in the sense that as we act on climate change, we need to ensure that we have an equitable future for everyone that promotes their health and their well-being, which requires systematic changes and a special, sort of equity lens, right, to ensure that whatever changes it is we make on a systemic level have to ensure that it provides equal opportunities to everyone. And I appreciated your last point too, in the sense that, for the record, nurses are actually more trusted than doctors if you look at Gallup polls. And so, all healthcare providers, and I would, again, sort of back to that image of all the people that are in a room when a patient is saved in an emergency department. I think it's important for everyone, and everyone has a voice, from environmental services to nurses to pharmacists, to people who answer the phones, right? And that's where collectively, right, if the discussion of us all rising up together and demanding this change, because what we need is political will, and if we're still in a democracy where it's powered by the people, and so if there is a unison and amplification of a common message by everyone within a healthcare system, I would like to believe that that will lead to critical changes. But I look forward to other people with local perspectives.
Go ahead, Mike.
Well, same here about all health professionals, not just physicians. Earlier, I mentioned this Health Leaders Fellowship program that the Ecology Center organizes. I briefly let you know what we provide and encourage you to take a look at it. We offer a year-long training program for health professionals from around the state of Michigan to get involved in civic issues, environmental health issues. And over the last 5 years, we've trained 80 people, 80 health professionals from around the state who are now advocates in Lansing and the state capitol, on local issues in Flint and Ann Arbor, Detroit, and other parts of the state. And I'd encourage you to take a look at it, or if you know colleagues, friends who might be interested in it, you can find out more information at ecocenter.org. A key element of, or a key part of our context for these issues are based in equity and justice, and they have to be, because the allocation of resources in the fossil fuel economy is one that has disproportionately benefited certain parts of the global population and disadvantaged others. The health impacts, environmental impacts from the use of fossil fuels has also been a far greater burden to people of color and to people of low income. And that's unavoidable conclusion from any examination of the evidence. And so solutions have to be grounded in that awareness too. And I think Guy can speak in far more detail and with far more experience about the application of those principles. But that's where we have to be coming from in addressing them.
Well, I'm looking at the crowd, and I don't know how representative from a racial diversity perspective the crowd is of the entire workforce here at the university in healthcare professions. However, it's just striking me that where there's not many voices, and that's a marker for power, then we're not gonna hit the mark on equity as something we actually achieve. No matter what the blend of diversity vectors are we're looking for, be it gender, age, race, or other cultural dimensions, right? Like if we're not having a representative mix of voices involved in the creativity and the decision making, for me, by definition, we can't have an equitable way forward. So I'm not embedded in this community, so I'm hesitant to critique it. I'm just kind of putting out the math problem to say, those of you who are embedded in it, to the extent you care about these things, look for allies and keep talking. I have the same, I'm repeating myself, keep talking and organize.
So I think a big part of the challenge that we have, and I'll speak really from a micro level about transportation, is that we are very focused very locally. So for instance, to help our staff get to work, we do subsidize some transportation from a little bit outside of Ann Arbor. It's not huge, but I think to be able to make some impact, we have to be thinking more regionally. And we can't solve it all from the university. So it's going to take some help of being more of a regional player, of including transportation from outside of, the Ann Arbor area and Washtenaw County. We have to participate, and maybe it's a more of an effort to market what's going on with regional transportation and the RTA and things like that. We have to get out of our little world that we can only control so much for our, kind of little Ann Arbor community.
Great. So I want to thank the panel for these really great remarks. Join me in thanking them. I think we've heard some really great themes in terms of health equity, keeping health in the conversation regarding climate change, and looking forward to the next 50 years and our next event 50 years from now when we get back together and learn about how we solve the climate solution and how you were a part of that. So thank you all for coming. We have a reception back downstairs where the dining hall was, so we can continue the conversation, and you'll have a chance to ask more of your questions that you didn't get a chance to ask. So thank you for coming.